Okay, you guys, Ralph Havens here, physical therapist at Beyond Limits Physical Therapy in Bellingham, Washington. And I'm here with Dr. Tom Giammatteo, chiropractor, naturopath, integrative manual therapy, co-developer of integrative manual therapy from West Hartford, Connecticut. And both of us over Zoom worldwide. And this is our podcast, When Doctors Have No Answers. And what we came up with today for the podcast, let me just see if I can pull up what I called it. Now I can't even see it, but oh, here we go. Actually, I don't have it pulled up, but basically it's like, why the gut? Why the gut? Why is that so important for healing? I see that for my runners, the running injuries. I see that for the chronic health conditions. It's wild. And Dr. Tom had a thing about, he said, we're the quantum physics of nutrition. So I want to talk about that and his the supplements that he uses to help people and how it can speed things along, GI regen and immune regen. And so, Dr. Tom, I've got all sorts of questions. I know I laid them out for you, some of them before, and it's like, whoa, a lot of things. But tell us a little bit about what your thoughts about nutrition and healing. And I've got the two slides you sent me pulled up so we can pull either of those up whenever we want.
Right. So I'm going to sidestep and make it a little different. I'm just going to step the door here. Okay. So hi, Ralph. How are you today?
Very good, man. Really good.
So, we've been practicing integrative manual therapy, which was a name coined by my wife and I in the 70s and 80s. And integrative manual therapy, over the 50 years that we've been practicing it, has definitely taken on a new dimension of medicine. And the Connecticut School of Integrative Manual Therapy has been around for 25 years this year. We started in 2001. So we are an alternative medicine practice that is fully integrated, that people can come to us with any symptom, and we may have a different type of process to heal them, right? So medicine's got pharmaceuticals, right? Chiropractors have adjustments and some nutrition. Naturopaths have nutrition. Homeopathists use energetic medicine. A medicine man, an American Indian, would also give you herbs, right? Or make this mud up. So let's do a historical perspective from medicine and just American Indian tribal stuff, that Dr. Baer, that is the founder of Baer Aspen Pharmaceutical Company, came over to America and had a headache, and he was introduced to willow bark tea, which has a salicylic acid, which is the chemical name for aspirin in it. So he drank a cup or two of the tea and his headache went away. He went back to Germany and he isolated out the chemical process, which is a salicylic acid. He condensed that down to an aspirin and made Baer aspirin as one of the first remedies for headaches.
Wow, I didn't know that.
Right. So white willows grow in all over the United States, and the American Indians would go peel the bark, soak it in water, very bitter tea, and they'd sip it, and that was their remedy for headaches. And people today use the aspirin in the same way. However, the aspirin has caused causes over $200,000 to $300,000 deaths a year from causing stomach ulcers in the gut. So if we go back to nature and the tribal process of drinking willow bark tea, it's so bitter that if you drank more than 2 or 3 cups, you'd get nauseous and you'd throw it back up. And actually, nauseousness is a protective mechanism natural in our bodies, that we don't want to bring it through our whole system. We choose to go out the other side. And Western medicine wants to stop nauseousness. Western medicine wants to stop headaches. Western medicine doesn't really want you to feel anything, right? So we have 2 principles. If you drank the willow bark tea, your headache would go away. And you only maybe need 5 grams of the salicylic acid to do that, but we put it into a punch. and that tears up our stomachs and all those pieces. It's been known in conventional science that 45% of all our neurotransmitters, mostly the serotonins, the ones that make anxiety, help you sleep, are actually a food-related neurochemical, right? We have to have good bacteria, the right bacteria in our gut, and we feed it the right foods, we get neurotransmitters going up to the brain that keeps us the serotonin group, actually. So it actually travels in the bloodstream and goes up to the brain. It's not in the brain that it's produced. So a lot of people on anxieties and depressions and panic attacks are been shown to have a leaky gut syndrome on the side. And Western medicine still chooses most of the time not to use that whole process. So if we change the diet, and you've used Western Price before, use our tools before of doing elimination diets, and we can see this change. But the American society has been sold this good package of go to 7-Eleven, have a big gulp, go to McDonald's, and all those sugary, salty, sour, glutenated foods actually cause more neurosis, more depression, more anxiety. And that's even been known in Chinese medicine and Ayurvedic medicine from India along the way, that those sweet, sour, and salty processes, actually, if you get them out of balance, you can have neurosis that way too, right? So we heard all that. We've studied functional medicine. We've gone back to ancient herbal types of medicines and different disciplines, North American Indians, Eskimos, South American, Peruvian, German, Siberian, Chinese medicine. So we take everything in and we find the common factors, and then we find the things that are special to that. And we've been studying functional medicine for such a long time. Integrative manual therapy actually uses a acronym BBFM for biophysiological and bioenergetic functional medicine, where we've heard the words, we use the tools, but we also have to look at, is the body able to receive it and accept it at the same time? And can we use energetic forms of nutrition like homeopathy or flower essences to be the blueprint that we can get the calcium or the zinc to go in faster, deeper into the right places? So we actually, you and I, practice a biophysiological, bioenergetic functional medicine, which is almost quantum physics of what general naturopathics and chiropractic and any herbal doctor really uses.
So that energetic imprint can be important to get a physical substance into the body. And then you briefly mentioned that the structural approach, like, can the body accept it?
Yeah.
Yeah. Is it?
So what we talk about is in biology and physiology, the liver has to do 500 different types of chemistries. Some are oxygenation, some are sulfurization, some are methylizations, and there's like 6 other types of chemical processes that have to go on. And that breaks down your red blood cells, it changes your hormones, and the liver is one of the most important producers of synthesizing the material you absorb and putting out most of the products. And we also have other glands like the pituitary, the adrenals, the hypothalamus that make their own chemicals. But in the main pipeline, after you digest your food, the liver is the guy that's almost like the Amazon that gives, okay, this guy needs zinc to do make his hydrochloric acid. This guy needs iodine in the thyroid to do, the hypothyroid and all those pieces. And so the liver is a pretty important place. And if you look at the purpose of the human body and what it does, or any mammal does, we all have rib cages. And it goes from our collarbone pretty much down to our belly button, and it V's in the front. But under that rib cage lives our vital organs. You've heard that word before, right?
Mhm.
Can't live without a lung, can't live without a heart, can't live without a liver, can't live without a kidney. You can live without a muscle or a leg, but all those other things are protected and they're covered by the rib cage, right? So what if the rib cage got broken and your liver now, which is supposed to live in a 2-foot box, lives in a 1-foot box? How do you expect that 1-foot box to do 500 chemistries? So
Yeah,
IMT and the approaches that we do is say, oh, the liver is stuck and you're also having PMS. Well, maybe if I get the liver to open up and we give it good food and we take out the sugars and the gluten and all these other things, maybe your
yeah,
PMS just disappears again.
yeah. So all those perimenopausal symptoms too, as well. Anything like,
Yeah.
and
So
yeah,
you've taken our men's and women's health course,
that was the first one I took in February of 2000.
right? And we talked about all the organs and how important the liver is. In Western medicine, I'm shamefully upset with them, never asks how the liver is, right? We look at AST and ALT, but that's about it. But I believe from all my different studies and in Chinese acupuncture and Ayurvedic medicine, no woman should ever have PMS, premenstrual syndrome, right? No woman should have cramps that debilitate them. And those are all indications that we have liver stress. And there's not really a lot of medicine, or the medical doctors don't ask actually how your liver is and what it deals with. And truthfully, we really don't have diagnostic tools in the traditional Western medicine principles that they really want to look at the liver, right?
Yeah, it's just if the lab tests are so bad that
Right.
it shows up as a lab test. And yeah, so
So
how's
all those indicate to me. And so the liver and the kidneys are designed as our primary detox routes. And the liver helps us produce the breakdowns of what the liver dissolves comes into our bile and makes our poop. And then it breaks it down and sends to some of the kidney, which makes our urine that bright yellow or orange color if we're not having a lot of water. So if we take the calculations of what uh, bowel movements do and plus urination does, it's about 2 to 4 pounds of weight. We also put out a lot of toxins through our breathing. We have microparticles always coming out. About another, if you calculate every time we breathe, it weighs about 7 pounds of dust comes out of our mouth. If we don't do that, then if we don't get the poisons out, we have to figure out how am I going to keep my body healthy? How am I going to work with having this poison sit in my body? Well, I could shove it into my fat, or I could try to excrete it out my skin. So when people come in with acne, psoriasis, any rashes, I see it as, the guys that are supposed to be detoxing aren't doing it. And
yeah,
so when menstruation comes around and we're detoxing the hormones, that equals PMS at the same time. So my ideal scene is that we help with a lot of women go from infertility to fertile, and then we help them, through nutrition and body work to receive the egg and get pregnant. And then even during the prenatal care, they come in every month and they come in for about 4 hours just because the uterus is stretching, right? You Every client that's in our prenatal care touches the floor every month. So when they get to be the 9th month, when they are ready to deliver their baby, the hips open up, the sacrum opens up, and their delivery channels are in the right way. And most women are having back pain. We have women that never have back pain, never have swelling in their legs and things like that. So
yeah,
we use the
you helped me
structural
a
care.
lot with Jen when Baden was in the womb and we got her bending to the floor and fixing up the body and improving the house of
Yeah.
Jen. And it was the best pregnancy ever. I mean, it was like the day he was born was kind of pretty much like a date. We just hung out all day and then we went in finally and then Baden came out.
I mean, she did feel a little pain
At the
as
very end, a little bit, yeah.
yeah, you're still passing a watermelon through a little
It
circle,
was a
but
good day though.
we got the bones available to move, and
Yeah.
the tissues needed to move, so we made it the least painful, and then the birthing canal doesn't tear, and then and those sufferings don't have to be there. You know, half my women don't need epidurals, right? And they can deliver without those things. So that is the optimal piece. So
Yeah,
the gut is very important throughout the whole process, and we can change those and manipulate that, but we have to have it receive the right stuff. You know, if you buy a brand new Porsche or a Ferrari or a Mercedes Benz and they tell you to use high test gas and you put the bad gas in there, you know you're paying for more mechanic bills. The same thing. We should really take our own food intake more serious than we do for our pets, more serious than we do for our cars. But we've been trained and zombied into, oh, go to Burger King, go to McDonald's. That doesn't have
yeah.
profit and stuff like that.
So it's like, to kind of summarize this bit so far, it's like get the house optimized, like not a 1 foot box, but the size it should be. So the liver and the kidneys and
Yep.
the lungs all live in a nice, good space where they can be healthier. And then put good things in, good food in, and then there's and then hopefully, so you hopefully get a little body work in that through this integrated manual therapy to get the structure right, and then to
Yep.
get your own nutrition dialed in. And then there's this part about, you talked about the homeopathy and also the supplements. You're not a big, like it's not like you're recommending a lot of supplements to people, but there's a couple of key things that you do, the GI regen and the immune regen and
Yes.
a whole
So the
bunch.
last talk we had was on GI regen,
Yeah.
and REGEN is an acronym for Responsible Ecological Growth Energized Nutraceuticals.
Well,
So
share that with us.
that's called the acronym of REGEN. So that tool is why we know we have about 10 products called Regen. So we have a GI Regen, which supports the GI and gut system. And then that's phase one. And after we get that, so it can absorb food and you're pooping good and you're peeing good, then we move into starting the immune system. So Immune Regen is another product that we have that regenerates the whole immune system. We've been hearing in, our Western media, everything's an autoimmune disease. And especially the current advertising on TV where they're showing people that match, they're having rashes and now they're not having rashes. All those medications shut down the immune system. They're trying to kill the immune system so they're not having the rashes. And IMT says, well, maybe the immune system doesn't know who it is and it's attacking with inside. So if we're able to absorb our food, then that channel opens up, and then we can teach the thymus gland, which is responsible for 50% of your immune system. And Western medicine has it wrong. In the physiology books, it says the thymus gland only lives for the first 6 to 7 years of life, and then it shrivels up and does nothing. Well, in people that are sick with diabetes, heart disease, that is true. But in people that have a good diet and never go to the doctors, their thymus gland actually lives in about a 4 to 6 inch span underneath their sternum and their collarbones. And in other animals, this is when you're ordering sweetbreads as a delicacy, it is the thymus gland. And there are many rituals that love, we have tapping and we have rubbing in this area. Okay. And it is such a powerful structural piece that if you've ever had a bad cough and you're just tired of it and you're getting down the cough, you actually hit
Yeah.
yourself in the chest, right? That is a pre-programmed primitive reflex. And when you do that, you actually vibrate the thymus and it squirts all the new white blood cells out into the bloodstream to fight the battle,
That's wild.
right? So um, it's very important. It could be the leader of thyroid conditions from hypo to hyper. And when we treat the gut and then the immune system, we've helped with Hashimoto's, we've helped with um, Cushing's disease and all those things by going to the back principles. Can we absorb our food? Is our white blood cell, is our immune system liking us? Do we know where we are? When you fix those two things, a lot of autoimmune diseases disappear.
So the structure gets better, the house gets optimized,
Yeah,
good stuff goes in, you quit putting bad stuff in, and then you can make your happy hormones and your other hormones and
yeah. So a lot of people think we're crazy, right? So the elimination diet list that we always talk about is no gluten, oats, or pyrimidines, which is the family of gluten and oats. No white sugars, but honey and maple syrup are good. No peanuts and no almonds because they have funguses and old bacteria that influence the immune system. We take people off of those, and most of the people have an addiction to one or all four of those at the same time. And it's like, no, I'm not going to give that up. Right. So if, again, if you're in a different part of the country, if you're on a boat, you're not going to get those things. And why is your physiological system and your brain say, I need it? They actually become addictive. They actually numb us up to the world. Okay. So they're the spectrum of using sugar, white sugar, in the next 10 to 20 years, the functional medicine groups have talked about, if we're really honest, the amount of sugar that we use in in all the world is to numb ourselves up, and it's going to be as illegal as aspartame or NutraSweet or all the other toxins.
so that would be wild. That would be wild. It is
And
amazing. And I tell so many of my runners with different chronic pains and conditions, and a lot of them actually have autoimmune conditions too, to get off of those substances, those foods, and they can get better so fast. Sometimes the next week they come back and all sorts of months and months and long time pains are just gone from that. It's quite amazing.
so reading labels, you should never have extra fructose
Yeah,
in
that's
your diet. If it's added in, everything from all Coca-Cola products, from apple juice to all their spry drinks, the Coca-Cola, all have fructose in them. Yeah, I tell people go get the Coca-Cola that says real sugar. It's healthier than those things. So we can go for hours of talking, even seeing fructose as a toxin in the world, right? And it's
yeah.
most of the fructose that you're seeing is a derivative of the corn industry. So we know that the gasoline has ethanol in it, and that's because the US government wanted to help corn farmers, so they make the grain alcohol out of it, and that's the ethanol. And a byproduct of that is the fructose out of the corn, and that sweetness goes into our diet systems, right? So fructose in my world is um, is a toxin that is total chaotic to the system.
Yeah, it even made the news recently about I won't go into particulars, but yeah, it's a cause of a lot of chronic conditions. So so that's good. Well, I'm going to put the GI Regen link
Yeah.
and Immune Regen link in the wherever you see this on Facebook or YouTube or Spotify, and reach out to us. And Dr. Tom can actually get on a short call with you and let you know what he sees that's going on in your body and get you
Uh,
some help.
yes, if you go back to the first recording of this series, which was 2 weeks ago, I'd watch that because we really went into the details of GI Regen.
Yeah.
And anybody over 100 pounds can take one in the morning, one at night, and it's an amazing benefit. I have friends of friends that they just they have a cold and they give them the GI Regen, and they were pretty healthy beforehand, and they're feeling peppy. They're back into life about a week or two after that. And
So yeah, doing the elimination diet and just doing that can save the need even for a lot of IMT. You still I would recommend the structural work to make the house that the liver lives in optimal, but just the diet and that could be huge. Um, Tom, so you mentioned perimenopause and all those kind of symptoms is something that can be helped when you get to the liver and the GI tract healthy. There was one question that came up earlier today. One of my clients had a question about varicose veins. Any short answer about that? Like, is that Is that GI liver thing as well, or what do you think of varicose veins?
Well,
Or is that a
we
whole
are,
other talk?
it's a whole nother talk. And we have the Connecticut School of Integrative Manual Therapy, which is a 12-week program. And this week, Ralph, we're actually in week 8, and we're talking about the lymphatic system and the circulatory system. And so varicose veins are when the pelvis is congested and can't do anything, the veins pop out in the legs,
Was congestion. So yeah, it makes sense. It's
right?
kind of
So it's no different than putting a tourniquet on somebody's arm and they look for the vein to draw the blood out,
yeah,
right? So that pelvic floor could be just because the gut is bad, like we talked about. So GI regen will help the gut, or the swelling from the gluten is enough down there, or they've had too many bladder infections and UTI infections and pelvic infections. So all that adds up. We were talking about our women that go infertility to fertility and then get pregnant. When a lot of women can't lie on their backs because their legs go numb. And if you have free flowing movement in there, it is you can move around and you can lie around and the veins actually just slide to the side and you don't have poor circulation. So there's probably 5 reasons of, maybe bladder infections led to that, poor digestion led to that, uh, pelvic pain, constipation, are all things that if you think closer to the heart, block those veins so they pop out in the bottom. And
got
then
it.
and Western medicine wants to just strip them, and now you've taken out half the drainage. Yeah, sure, they've blown out and they're painful, but it's not, that's just the tip of the iceberg. It's not asking why did they blow out or how did they blow out.
Yeah.
So they just numb you up until the next one and they do whack-a-mole, you know?
Yeah. Well, thank you for that. That's a very good, big answer for such a short amount of time. And it makes so much sense. The pelvis, the house of the pelvis is not doing well, and it's got some toxicity on there. So IMT can help with that. Tom's phone number is 860-561-2286 in West Hartford, Connecticut. Again, reach out to him, imtwellnesscenter.com. And whether you're a practitioner or you just need some help physically, and he's got classes and he has a clinic and he teaches all around the world. And I'm Ralph Havens. I'm in Bellingham, Washington. I've known Tom since February of 2000. And 360-599-2217 and ralphhavens.com. And we do this podcast a couple of times a month on Wednesdays. And Tom, thanks a lot. And thanks for going over. Really, really good. Got to get some more people on that GI regen and get them off of the bad stuff. Thank you so much.
Okay, Ralph, have a great day.
Have a really good one. Thank you, Tom.